You look tired. Have you had enough sleep? Your eyes look puffy. Have you had enough water? Are these the questions that you face on a regular basis? Well, I have a permanent fix for you. I am Dr. Shilpi Padani. I'm a plastic and aesthetic surgeon at SB Aesthetics, Gurgaon, India. So when we talk about the freshness of your look, the periorbital region, which is exactly this area, has a very important role to play. And when we are talking about hooded eyelids, saggy eyelids, puffy eyelids, or in fact, loose eyelids, blepharoplasty is your solution for a long term. When we look at the puffy eyelids, for example, you see that she's a young woman, but still this puffiness around her eyes makes her look tired even though she's not. Even the upper eyelid, you see, it's slightly hollow, slightly loose. So obviously, when we are talking about a solution to these problems, it cannot be non-invasive. It has to be a surgical solution if we are wanting a permanent or a long-term solution. So what do? Here, for example, in the puffy eyelids, what we do is, because she's young, her skin is not that lax, we can do a transconjunctival blepharoplasty, which is done from inside and there is no scar, and we can take out these fat bags like you see in this picture, that the fat bags are gone after the surgery. Even for the upper eyelid, which is loose and hanging almost, we do a upper blepharoplasty and then we can fix this laxity of the eyelid. I've also done some fat grafting on the inner side to give her a complete makeover of the eyelid area. You can see well in this picture that this depression that you see here has been fixed with fat grafting, and the laxity or the looseness of the upper eyelid has been dealt with an upper blepharoplasty. And here the lower eyelids, we've done a transconjunctival blepharoplasty or removal of the fat bags only. I also prefer to do some lasers for the skin tightening when I'm not removing skin. Even in this young gentleman, you can see that his droopy eyelids were his problem, and even these puffy eyelids. And we've done an upper blepharoplasty and a lower blepharoplasty to give him a lifted look in the upper eyelid and a less full look or less puffy look in the lower eyelids. When we look at the scars, of course, in a transconjunctival or a blepharoplasty which is done from inside, there is no scar, obviously. But many people are concerned about the upper eyelid scar, and you can see in this picture that there's hardly any scar of the upper blepharoplasty, even when you talk about early results, because we carefully place them in the crease of the upper eyelid. And when we talk about the puffiness of the lower eyelids, definitely in younger patients, my choice is a transconjunctival blepharoplasty, which is done from inside, and we also do lasers outside for the tightening of the lower eyelids. For him, I've also done an upper blepharoplasty, and you can see that the eyelid has a lifted look. Even in advanced ages, we can do the same things, but again, in them, what we see is that the lower eyelid is also loose, and that is why we'll need some fix for the loose skin. And we can do a transcutaneous blepharoplasty or from the skin. So in her case, I've removed the fat bags as well as removed some of the skin. Of course, there's still some swelling, and that will settle in due course of time. This is an early result. In the upper eyelid, you can see that the lift that we've attained with an upper blepharoplasty is definitely not possible with any non-invasive treatment. And it's a surgery that can be done under local anesthesia if we are doing transcutaneous, that is from outside. And of course, the upper eyelid can always be done under local anesthesia. For this lady, we also did a brow fixation from inside only, and we didn't need a cut on the upper part. And from here only, I have fixed the brow over here. And from this position, the brow is less likely to come down further in due course of time. So talking again about the upper blepharoplasty, it gives a very rejuvenated look, and it is the only solution to the droopy eyelids over here. Of course, we can do forehead botulinum toxin injections and can make the lateral half of the brow lift, but that is again temporary, and the upper blepharoplasty is almost like a permanent fix for this problem. Even here you can see that these droopy eyelids have been fixed with an upper blepharoplasty, and here of course she needs a brow lift also. But again, that can be done in stages, and we've planned one for her in the coming months. Again, coming to the lower blepharoplasty, now what happens is that sometimes patients will come to me and say that, doctor, we are not ready for surgery as yet. So in that case, let's say we are talking about the lower eyelid puffiness. If the puffiness is not too much, we can definitely camouflage them with fillers. But you need to understand that that will have a limited result and you will need to repeat it in due course of time. So roughly about a year that you will need to repeat the fillers to have the fat bags camouflaged. If you are obese, then weight loss will also help in reducing the puffiness. But again, it depends from individual to individual. And when we are talking about a wholesome treatment for the periorbital rejuvenation or the freshness that you want in your look, it can be had by the upper blepharoplasty, the lower blepharoplasty with or without skin removal, and the third one in this treatment could be a brow lift that we can very easily achieve by the hairline incision or a little behind the hairline incision, and that can give you a lifted look of your brow, thereby opening up the eyes really. So I hope this video will clear your doubts regarding the puffiness and the sagging and the hooding of the upper eyelids. And if you have questions, do write to me. We shall be very happy to answer them. We've got a lot of videos made on blepharoplasty as such also. We've got a procedure also. You can watch the procedure, but definitely you're free to write down your comments and we'll be very happy to answer your queries. Thank you so much for watching.